First of all, everybody needs health. Health means in Ayurveda, it means vata. It means balance and of the homeostasis of the internal environment. This can be done by moderation, regularity, rest and activity. This is usual activity of the human being. Health doesn't mean only not have a disease, but being balanced. In the Ayurveda, our body and everything consists of 5 elements: space, air, fire, water, earth. When we are living in this world, we have to receive intake, and what we take in is the many food, water, air, including our lifestyle and also the environment. Then when this comes into our body, it will be assimilated and integrated to be one of ourselves. After that, we have to eliminate output. We put the increasing activity of body, mind, and speech and lifestyle. Simple lifestyle habits. Usually we need some sleep. Eating breakfast almost every day. Eating between meals, not eating between meals is probably difficult. You need no weight. And regular physical activity, moderate drinks, and a little bit alcohol is all right. Never smoking a cigarette, the body then is difficult. Now we will look at the cause of disease. You see, the cause of disease mainly due to our lifestyle and diet. To maintain the genetic play only a small percentage. Now, look at the cancer. Cancer, usually, now we know that cancer, 80 to 90% of cancer comes from environment and diet. 2 or 3% from genetic. This is being done scientifically, concluded by the experts. Now look at some of those statistics here. The vegetarian people, the 7-day Adventists, prostate cancer mortality rate is about 30% less than the average. The incidence of the prostate cancer related to the consumption of dairy products, eggs and meat. High milk intake, you will get high risk of breast cancer, mouth, colon, stomach, lung, bladder, and cervical cancers. This is done by the Roosevelt Park Memorial Hospital in New York. Women who have the consumption a lot of the animal product, you get the greater amount, they have 3 times cancer risk. Now look at statistics. This is done about 30 years ago by the Canadian professor. You can see correlation between the dietary fat intake and the rate of death rate in 100,000 population. Thailand ranked very lowest in the world. And now comparing again between animal fat intake and death rate. Thailand is also the lowest. That's 30 years ago. Vegetable fat, we take low and we have low incidence of the cancer also. Nowadays, cancer is one of the first one of the mortality rate in Thailand now. Now look at it, carcinoma of breast. It's carcinoma of the breast related to the age of the menarche. That is the first enter the first menstruation. Now, the more the younger, the more they will get more breast cancer, high blood cholesterol, menopause, high exposure to female hormone. From early age of the menstruation to the late menopause will result in high exposure of the female hormone. Now, cholesterol is related to a lot of the diseases. This is done by Dr. Campbell from Cornell. This is the China study. He concluded that the strongest predictors of vessel disease was blood cholesterol. These include cancer, atherosclerosis, obesity, diabetes, hypertension, and degenerative disease. Cancer, early detection and prevention. Nowadays, in medical world, they used to say that early detection to prevent cancer. That is not true. You can see the cancer of the colon. When you detect it, very difficult to detect. If you want to detect, you have to go to do this examination, variant enema or colonoscopy. But look at the chart. You can see that this is Chia and this is number of cells. If we give it one cell, it takes about 6 years, 7 years, they will have 1 million cells. That is only 1 millimeter size. When you have a cancer of 1 centimeter size, it has 1 billion cells. This is, you cannot feel it, 1 centimeter. The mammogram can detect about 2 millimeters. When you detect it more than 1 centimeter, it means that the time has passed for how many years. So prevention is much better. This is one of my cases. You can see that this patient comes to the hospital every year for checkup. This is good, and at his chest view, you can see that. You can see it. You can see the smallest one. You can see here is about 7 millimeters. You see, if you go back to the large size, you can see that 7 centimeters is close to 1 billion cells already. And this is the first time we detect it. So the patient asked the doctor, how come I come to the hospital every year and you let this going on? No answer from the doctor. When you do the CT scan, you can see this clearly. This is. Now look at the back to the breast again. The risk factor of breast cancer is, as I said before, and now go to the other cause of death in Thai people is the heart disease, the coronary heart disease. Coronary heart disease, now they could be divided into 2 types. One is slow growing and they will give you some symptoms, chest pain or pain on exertion. The other time, no symptom at all. The other time, the first one is slow growing. We call the heart plaque. Usually will not cause any sudden death. But the second time is the soft plaque. This one, you don't have any symptom at all. This type, when it ruptures, it will cause you death within a few minutes. 50% of this heart attack is the first one and the last one. This type is very important. You can see this from angiogram of the coronary artery. This is the narrowing of the coronary artery in front of the distal part. This man is 43-year-old surgeon at Cleveland Clinic and almost right from Cornell University lecture. he has a heart attack following surgery for the other people, not himself. And after that, he refused any surgery, any bypass or any damage. So his friend gave him a plant-based diet for 35 to 36 months. You can see the vessel come back without any medication, without any thing. This diet includes low-fat, vegetable-based diet. Not a single drop of fat. If fats come along with the other things, it's all right, but no cooking with fat. This is a diagram to show that the normal artery here, when the blood going on like this, going on like this. That kind of the lesion can cause you a heart attack only 12.5%. And this is at the time that we call the soft plaque. When the plaque is broken here, we call it clotting of the vessel, and this will cause the 83.5 heart attack. Now look at the PET scan. They use the radioactive material to see that how far and how bad the circulation to supply the heart muscle. This is before the plant-based diet. You can see this is lack of the blood supply. This is lack of blood supply to the heart. At the treatment, this is about 3 months. If you cover treatment, is using the plant-based diet only. This is another case. You see the dropping, and then after low-fat plant-based diet, it come back. When you take a plant-based diet, the plaque is here will get smaller and smaller. Now look at diabetes. The diabetes incidence is very high in the Western population. What we can do by diet is we give this patient with the high carbohydrate. This is complex carbohydrate, not the refined one, not white rice. It has to be brown rice, something like that, and high fiber diet. You can see the cholesterol will lower down very nicely. Now look at the cell. When we eat something in carbohydrate, insulin had to take care of the thyroid to bring the carbohydrate into the cell, and the glucose in circulation will be lower down. Now, if you eat a lot of animal product, the sensitivity of the insulin will lower, and the glucose cannot get into the cell. So high blood sugar will be. This is why when we treat that diabetes, just only for lowering the carbohydrate is not enough. You have to lower down the animal product also. Now look at cancer in the hospital. This is in experiment, the aflatoxin in the chemical that cause the cancer of the liver. If we feeding rat with 5% protein from milk, with casein and 20%, you can see when we feed 5%, no cancer in rat. If we feed them with the 20%, a lot of cancer. It's the same, 5% and gluten here and 20% here. The lowest animal protein will lower down the incidence of cancer. in animal, nutrient from animal-based food increase cancer. Tumor development, while the nutrient from plant-based food decrease tumor development. This is the China study done by Dr. Chalie. Now, so we would advise that you should avoid some of the meat, dairy, or processed refined grain, too sweet, too salty, include nuts in bigger amount. We prefer vegetables, legumes, whole grain, and fruit. The carbohydrate, you have to understand that carbohydrate should be from 99 from fruit and vegetable and grain, whole grain. This is to prevent and reverse heart disease and diabetes. See, the complex carbohydrate contain fiber, vitamins, minerals, and phytochemicals. Look at our lives at the tree. We don't see the root down below, but our life is feeding by nutrient from below. The root create what under the ground, create what's above. What's invisible create what's visible. So this is the example that we have to take care of how to feed our lives